Hello everyone, welcome back to my channel. So today we are going to discuss a very important topic, that is like TMJ disorders. This topic is usually asked in anatomy also, and also in oral surgery in ADAT exam. So you must know all the symptoms and signs seen in TMJ disorders, so you can differentiate like it is due to like internal dearrangement or like interior displacement with reduction or without. So let's start. So the first disorder is the disc displacement disorder. So in the first distinction is the often associated with the synovial inflammation, and this displacement is usually the end result of inflammation and chronic joint overloading. So abnormal relationship between the disc and condyle. So this is the disc displacement, and it is due to internal dearrangement. So let's see this one, which is abnormal relationship of the articular disc to the mandibular condyle, fossa, and articular eminence. So there is a posterior band of the articular disc which is interiorly displaced in front of the condyle. It got displaced, and as the articular disc translate interiorly, the posterior band remain in front of the condyle, and we are not able to close the mouth. The retrodiscal tissue is extremely inflamed, and functional loading causes further significant inflammation. Inflamed synovial tissue are not able to produce an adequate synovial fluid, resulting in poor lubrication and reduced mobility. So mobility of the joint is reduced because there is less synovial fluid. And now with the next one, we have interior displacement with reduction. It is asked many times, so these two are very important. So mostly these are tested like this one, the interior displacement with reduction and interior displacement without reduction. So these are the most important which are asked, but I want you to make sure that you know all, so you can differentiate between, okay, this is with reduction, without reduction, like internal derangement, or like chronic recurrent dislocation. But mostly these two are asked, so make sure that you learn these two by heart. So let's start with the first one, that is interior displacement with reduction. So displacement posterior band will return to its anatomical position. When the articular disc reduces, the patient often experiences clicking and popping. So when in the question it will be mentioned that there is a clicking or popping sound, then it is the interior displacement with reduction. And what is the interior displacement without reduction? So it is this one, without reduction. Condyle is unable to translate fully to its most interior position. So patient is unable to open maximally, like there is not the maximum mouth opening there. Okay, so patient is not able to open mouth like to the maximum we can open. And there is also deviation of the mandible to the affected side. So mandible usually deviate to the side which is affected. So the first thing is the most interior position and unable to open maximally, and then is the deviation, which side? Affected side. And no clicking occur in the patient. So this is the main thing, so we can differentiate. In interior displacement with reduction, there is a sound, there is a clicking popping sound, but without reduction there is no clicking sound. Then we have significant synovial inflammation and adhesion are associated with this condition. And then this the chronic reduction dislocation. This is secondary to mandibular hypermobility. Mandible condyle dislocate interior to the articular eminence. Secondary severe spasm of the muscle of the mastication cause additional severe pain, and often reduction of the dislocation is difficult. So in this one, there is a treatment where is we manually manipulate the posterior mandible inferior to get the condyle below the articular eminence, then posteriorly to position posteriorly to the position into the glenoid fossa. So LA local anesthesia is given into the muscle of the mastication, or IV sedation may be necessary to overcome the severe masticatory muscle spasm. So following reduction of the dislocation, the clinician may decide to prevent dislocation by using temporary elastic maximum mandibular fixation. So these are the TMJ disorder. But always remember, when you have the question to see, okay, it will be mentioned in the question, okay, the patient is unable to open maximum, and then it will be mentioned, okay, there is no clicking sound and there is clicking sound. So it will help you to differentiate it is without reduction or with reduction. Thank you.